Hey everyone, Dr. Ryan here from Fundamental Health, and today I want to talk to you about low back pain. And while the cause may not actually be in the low back, it may be due to your hips or your feet. And this holds true for knee pain too. Oftentimes as practitioners we're chasing the pain, or as a patient you come in and you want us to address the pain or the symptoms that you're experiencing, but oftentimes the problem can actually be from somewhere else. In this case I'll explain the two reasons of why you're having the low back pain. First being the hip, second being the faulty feet. So how did we get here? How did you end up with back pain or knee pain or shin splints from running too much? How did we get here? Well, let's all trace it back to common causes.
Because we are sitting most of the day, due to work and Netflix, our muscles are becoming weak and tight. This changes the way the brain communicates with the body and how the body learns to move. The body will react and adapt to this new neurofeedback, creating faulty movements. This usually begins from the ground up, in which the ankles become very tight, causes rotation of that bottom bone, the shin bone, which then causes counter rotation of your big long bone, the femur bone, putting a lot of stress on the hips and knees.
So what can you do? There are some simple steps to follow to help out this problem. And the first is very obvious. You need to cut out whatever that cause is that's causing the hip inflexibility, instability, that's really putting more pressure on the low back and other areas of the body that it shouldn't be. So you need to find that cause, whatever it's contributing to the problem, and we need to get rid of that completely. The second step is to have a professional, someone like a doctor or a trainer, really look at you and assess your different movements. They need to assess your flexibility. You shouldn't just go trying whatever stretch and whatever exercise you want because you think it may help. There are certain patterns that we're looking for as professionals, and you need to have someone who knows what they're doing take a look at you to figure out which muscles need to be stretched, which muscles need to be strengthened, and then have a good course of action. I really recommend really good trainers, personal trainers that are trained in functional movements. Okay, so now I'd like to show you some of my favorite stability exercises to really help stabilize things in the hips. And what I'm going to show you first are the two ones that I highly recommend for the big glute muscle. That basically makes up your butt here and is a very strong muscle. We need to start working on this muscle to get it stronger. Okay, the first one I'm going to show you, you get on all fours, just like this. And what you're going to do is you're going to keep everything stable, use your core, keep your back straight, okay? And then you're going to slowly bring one leg back and extend it out as far as you can. So if you remember back, I was telling you we need to work on rotation, hip hinge, and extension. This is a great exercise for working on that extension part, okay? You want to make sure your back stays flat. You want your leg to be parallel and in line with your back. The other good one, working on that glute, laying on your back. You're going to get in this position. Your hands you can put off to the side, you can put in the small of your back, whatever's easier for you. I keep them right down here on my side. And what you're going to do is you're going to bring your butt up towards the ceiling. You want to get about straight line right here. You don't want your butt up too high or too low. But you bring your butt up here and then you hold this position for a while. If this is too easy and you want to make it harder, go up on one leg, keep the other straight, and do the same thing. In these movements, you are activating that glute muscle like I said, and we're getting it to work at the same time while stabilizing the hips and pelvis. So now I'd like to show you two of my favorite exercises that are going to help stabilize the hip, but helping the rotational forces. So now we're going after the glute med and min, which are smaller muscles out here on the side, which, like I just said, have to do with stabilizing so that your hips don't rotate too much, or if things are too tight, we need to increase rotation in those hips. First one I wanted to show you, it's called a clamshell. So you get a TheraBand if you have it. Otherwise you can do these against gravity. So just imagine that you don't have a TheraBand and it's not on my legs here. But you're going to lay on your side and you're going to do this both ways. You're going to put your legs right here. You want to make a nice straight line. So your hips, your shoulders, and your ankles should all be in line, okay? You're going to lay on your side and all you're going to do is you're going to open up like a clamshell and then bring it back. What you don't want to do is open up so much that you start leaning back, then you're recruiting other muscles. It's just a short movement here, bring it back, short movement, bring it back. And then you'll do this both ways. That's going to target that glute min. And the other exercise I really love for the glute med and glute min, the muscles we're targeting out here with that rotation, is to stand one leg, put a band around your leg, stand on one leg like this, Bring that other leg up and then hold this position. Force yourself to hold this position. You're activating your hip stabilizers, those rotation muscles to keep your hips stable, and then you have that resistance so your knee doesn't bowl in and you keep it out because you don't want that knee diving in on you. So this is another good one to help with that rotation of the hips. So it's important to know that some muscles may need to be stretched and improved upon their flexibility because maybe your hips are too tight. Also, some muscles may need to be strengthened. So if you have instability, you want to strengthen certain muscles like the glutes that I showed you in order to help take the pressure off the back and the knees and these other areas. So a couple of exercises I already showed you have to do with stability. Other good strengthening exercises are a little more advanced, and I'm talking about more like a squat, a deadlift, and single leg lunges. Make sure you're working with a provider. Make sure you're working with somebody who knows what they're doing because it's very easy to mess things up. And then so oftentimes the hip flexors can become very tight, and the hip flexors are a group of muscles that come from the leg across into the pelvis. And it's oftentimes because you're sitting too much or you're inactive, so these muscles tighten up over time. So what we need to do is stretch them. And here's my favorite stretch for stretching these hip flexors. You're going to want to do this both ways. What you're going to do is you're basically going to get on one knee and you're going to put one leg forward as far as you can. You're going to lean your body weight into that front leg and let that back leg be back like it is right now. You're really going to feel that stretch right here in the front of the groin. To make it a little harder and then stretch out another muscle, you have a quadratus lumborum muscle, which is a big muscle here in your low back too. This can get very tight in individuals, especially if you're sitting all the time. So my favorite stretch is you can go after both of these by leaning forward like I just showed you, then put the opposite arm of the leg that's forward on your leg and twist more in that direction. You should feel that good stretch all through the back here going up to that quadratus lumborum as you're feeling it in the front here. So that's it, guys. I hope you got some great value from what I shared with you today and really learned the importance of freeing up the hips, allowing them to move the way they're supposed to, and then making things more stable so that takes pressure off your knees, your low back, shins, other areas so that you have good stability from the lower down. So the other part of the equation is you may have back pain due to the hips, or you may have back pain due to faulty feet or leg length imbalances. Stay tuned for next video. Next video I'll go over those areas, how we can treat them, what you can do about them, and what options you have available so that ultimately you can be back pain free. Take care, guys.